Welcome, everybody. I'm Melissa Atchison with Manitoba Beef Producers, and MBP and MBFI are really excited to partner on this initiative and bring producers some information on cow repro and factors that affect repro rates. So this is the second installment in this series. Pleasure to introduce tonight's speaker. We have Dr. Brittany Sigvason. So Brittany received her Doctor of Veterinary Medicine from WCVM in Saskatoon in 2017. Her career started with 5 years in mixed animal practice, but her passion was always in the beef cattle industry and that wheelhouse. So she is now a part of the great team at Veterinary Agri-Health Services in Crossfield, Alberta. She is also a board member of the Western Canadian Association of Bovine Practitioners. Dr. Brittany lives in Strathmore with her husband Kyle and son Bjorn. She enjoys spending time with family, camping, playing hockey, and riding her horses. So everybody, welcome Dr. Brittany Sigvason.
Thanks, Melissa. Good evening, everyone. First off, I want to thank the Manitoba Beef Producers and the Manitoba Beef and Forage Initiatives for the opportunity to talk to you all tonight. I hope that you enjoy my presentation, or at least learn a little bit. Basically, I'm going to go through some of the common infectious diseases that affect fertility and reproduction in beef cattle in Western Canada. And what you can do to prevent these diseases or minimize their impact. To get started, we are going to be doing some polling questions this evening. So for the first question, I just want to know who is watching the webinar this evening. Are you a producer involved in the agriculture industry, but not necessarily a producer, both 1 and 2, or a veterinary professional? So you guys can't see the questions, unfortunately, that answers, but we have 71% of you are producers, 18% are involved in the agriculture industry, 6% of you are both 1 and 2, and 12% of you are veterinary professional. So whoever you are, thanks for being here. Okay, so my plan for this evening is to work through a few cases to highlight the important infectious diseases that affect fertility. The first case that I have is this 2-day-old bull calf. Just going to start the video here. So this calf was laying down when he was first tagged at a day old, so they didn't notice this. But by the second day, they noticed that the cow's bag was full and that the calf was like this. He was unable to stand and suck, so unfortunately he was euthanized. One more time so everyone can see it. How abnormal this calf is on this gate. So really unstable, wobbly guy. Okay. So a little bit more history about this herd. This calf came from a 300 head commercial cow-calf operation. The herd was not on a consistent vaccine program. And this producer also bought a group of pregnant cows from the auction mart in the fall and added them into the main herd without quarantining them first. Also, just want to mention that the calf in the video was born to a cow from the main herd, not one of the bought cows. So another poll question already. I promise I'm not going to keep track of the scores, so don't worry. Okay, so which disease is the herd dealing with? Option 1, rabies. Option 2, bovine viral diarrhea. Option 3, polio. Option 4, white muscle disease. So again, I'll just go through the results. So nobody answered rabies, which is good. 39% of you answered bovine viral diarrhea, which is actually the correct answer. 6% answered polio and 4% or 61% answered white muscle disease. So the correct answer is bovine viral diarrhea. We will talk about why. Okay, so before I focus in on bovine viral diarrhea, I just want to highlight the 4 diseases that I'm going to be discussing this evening and kind of outline when they're going to have the most impact on our cows' pregnancies and fertility. The 4 pathogens are bovine viral diarrhea, Campylobacter, Leptospirosis, and Trichomonas. On the left side of the diagram, it distinguishes whether the pathogen is a virus, bacteria, or a protozoa. And then on the bottom of the diagram is months of gestation. So I just want to note that on the timeline, I have included 0 in the months of gestation to indicate breeding time prior to conception. So the spread of the arrows indicate when that certain pathogen generally has the most effect on the cow's pregnancy and or fertility. This does not necessarily mean that the cow and her fetus cannot be affected at other times. I just wanted to emphasize when the greatest effect was. So I'll get into each specific pathogen as we go along, and we can revisit this diagram again towards the end of the presentation. So what is bovine viral diarrhea? BVD is a pestivirus. Out of the 4 infectious causes of decreased fertility that I'm discussing today, this is definitely going to be the most commonly encountered disease. So the disease leads to immunosuppression and can affect multiple body systems, including the digestive tract. But the name bovine viral diarrhea is actually misleading because immunosuppression or weakened immune system is actually the hallmark sign of the virus, not diarrhea. So clinical signs include inapparent or a non-obvious infection, fever, depression, decreased milk production, infertility, diarrhea, and death. Clinical disease is most common in animals 6 to 24 months of age. The majority of animals that are infected with this virus are going to improve after 3 days, minus persistently infected animals that get mucosal disease, which I'm going to talk about in a few slides. So how does BVD affect fertility? The BVD virus is actually quite complicated, and we can see different results depending on when the cow is infected during pregnancy. So if the cow is infected before insemination or during the first 40 days of pregnancy, we're going to see infertility or embryonic death. If the cow is infected during days 40 to 125 of pregnancy, if the calf survives, she's going to give birth to a persistently infected calf. If she's infected during days 100 to 150 of pregnancy, we may see congenital malformations of the central nervous system, including cerebellar hyperplasia, hydrocephalus, microencephaly. So basically, the calf in the video, this is what happened to it. It had cerebellar hypoplasia, resulting in its abnormal gait and neurological signs, its wobbliness. So basically, in that case that I talked about, when that producer bought the pregnant cows from the auction and mixed them in with his main herd, one of the bought cows was likely shedding the BVD virus and infected an original herd cow that was 100 to 150 days pregnant, resulting in this calf with cerebellar hypoplasia. And then lastly, if a cow is infected over 125 days pregnant, she might either abort that calf or the calf might be totally fine and its own immune system will clear the virus. So I just want to talk about persistently infected animals or PI animals. So as I mentioned in the previous slide, if a cow is infected with BVD during days 40 to 125 days of pregnancy, she may have a calf that's persistently infected. So what does this mean? It means that this calf will be infected with the virus lifelong, and it is going to constantly shed large amounts of the virus through its excretions or secretions. Persistently infected animals act as a natural reservoir of the virus, and prevalences in our cow herds are actually estimated at about 0.6%. if animals become infected with a mutated form of the BVD virus, so what happens is these persistently infected animals have a non-cytopathic virus in their body at all times, and it mutates internally and becomes cytopathic, then they develop mucosal disease. And when these animals get mucosal disease, it's very highly fatal. So signs of mucosal disease are usually profuse enteritis and diarrhea, and then they also often have mucosal erosions in the mouth and throughout the GI tract. PI animals can be small, poor-doing animals that are prone to pneumonia, diarrhea, or other diseases, but sometimes they can appear completely healthy and be a normal size, so it really can be difficult to identify them without testing. Persistently infected animals usually have a short lifespan and die before the age of 2, but if a PI female makes it into the breeding program and lives long enough to have a calf, then that calf is always going to be a persistently infected animal. Persistently infected animal. So you can see how that can be an ongoing problem. So here's some examples of what a persistently infected animal can look like. So in the top left here, you have an animal that just kind of looks like a poor doer, poor hair coat, has very bad ringworm infection on its face, maybe some diarrhea, just not a healthy looking animal. On the right here, we have two animals that are exactly the same age, and the one on the right is the persistently infected animal. Again, a little bit smaller, stunted growth, kind of a sickly animal. They just are typically like a poor doing animal. But then on the bottom left here is a group of yearlings, and really they all look healthy. They don't look sick at all. The one on the left is the persistently infected animal, and the only difference that you can see with him is that he's maybe a little bit smaller than the rest of the other animals. So again, it can be really hard to pick out those PI animals, and they don't always look like that poor doing animal. Sorry, my mouse is touchy. Okay, so how are we diagnosing BVD? A lot of times we're going to go off the history, the clinical signs. We can use postmortem lesions to diagnose BVD, especially in those animals that die, those PI animals that die of mucosal disease. Some of the lesions are pretty obvious in those animals. Basically, the definitive test to diagnose BVD involves isolating the virus in a variety of tissues. So in an aborted calf, the spleen is going to be the tissue that we test. In a live animal, we take a skin biopsy and test that. So doing ear notches at birth are going to be the most cost-effective way to test for PI animals. Okay, so unfortunately, there's no treatment for BVD other than supportive care. Our main focus should be on prevention. So number one, removing these persistently infected animals. The best option to identify these animals is going to be the ear notch testing, as I already discussed. But any young, poor-doing animal that keeps getting sick should be a suspect PI animal and either be tested or just removed, especially if your herd is not on a regular vaccine program. And then the easier option is just to prevent the PI animals in the first place by having your herd on that regular vaccine program. So just a bit of foreshadowing. You're going to hear me mention vaccines quite a bit. I promise we will tie it all together in the end. So next case that we're going to do, this was a herd of about 120 head. The cows are split into 4 different groups for the breeding season. Bulls are out for 100 days. At Prig Check, there was one breeding group that had a 13% open rate. The average for the other groups was around 7%, but it was also noted that the majority of pregnant cows in this group were bred at the tail end of the breeding season. So lots of very early pregnancies. This producer had leased a 6-year-old bull from a neighbor for this particular breeding group, and the herd is on an annual killed 5-way fall vaccination program. So the next pathogen that we're talking about is bovine genital campylobacteriosis. So this is a gram-negative microaerophilic bacteria, meaning it likes to live in environments with just a little bit of air. And the bacteria is either Campylobacter fetus venerealis or Campylobacter fetus fetus. It is transmitted venereally and also by contaminated instruments, bedding, or by artificial insemination with contaminated semen. And the infection tends to be transient in young bulls and chronic in older bulls, and they're going to be the main carrier of this disease. So the primary reason that younger bulls have a transient infection, while older bulls tend to have a chronic infection that they don't ever clear, is that the older bulls have deeper folds and crypts in their skin of their prepuce that create that ideal environment for this bacteria to grow. And in cows, the duration of infection is also quite variable. Some cows are going to clear the infection rapidly, while others are going to carry it for 2 years. So another poll question, what is another name for bovine genital campylobacteriosis? Trichomoniasis, Q fever, vibriosis, or chlamydia? Okay, so we got our answers back. So 56% of you answered trichomoniasis, 38% of you answered vibriosis, and 6% of you answered chlamydia. So the correct answer is actually vibriosis. So this is Vibrio, and that's how we more commonly see it on commercial vaccines. It's the V component in those vaccines. So what are the clinical signs of Vibrio? So typically with genital campylobacteriosis, the cows are often systemically normal. What the bacteria does is it causes an endometritis or an infection in the uterus that results in early embryonic death, irregular estrous cycles, and repeat breeding. So we may see longer calving periods as a result, assuming that the breeding season is long enough to allow for complete clearance and a successful rebreeding. If the breeding season is not long enough for the cows to clear the infection, then we're going to see higher open rates. So most cows will clear this infection after 2 to 3 cycles and then become pregnant and carry a healthy calf to term. So in the case that I talked about, their breeding season was 100 days long. So in some of these cows, it was long enough for them to get the infection, have it for a couple cycles, and then get bred at the end of the breeding season. Abortions can also happen with this bacteria, but it's not very common, like abortions later term. So, and then if the bacteria persists within the herd, we usually see it affecting just the replacement heifers and the few susceptible cows year after year. Bulls that are infected with this are completely asymptomatic and they do produce normal semen. So how do you diagnose Vibrio? So if you're having an outbreak, a vaginal swab on cows is useful, but because the cow variability in individual responses is so varied, we say that you should at least be sampling 10% of the cows or at minimum 10 animals. So it can be a little bit tricky. The most common test that you're going to see used is a preputial scraping on the bulls. So they're going to insert that pipette into the sheath with pressure and then suck up some culture medium into that straw, put it back in there, and then we're gonna culture that bacteria. So treatment and prevention for Campylobacter. For practical reasons, cows are usually not treated with antibiotics because one, it can be difficult to tell which cows are actually positive, like they may have already cleared the bacteria when we do our testing, and it's just not practical to give the entire herd antibiotics. On the other hand, vaccination is used as effective treatment and prevention. So Vaccination should start as soon as the genital campylobacteriosis is diagnosed. Infected cows and any cows at risk should be vaccinated. Vaccination of the infected cows quickens the elimination of the bacteria, and although many cows may remain carriers, fertility is still greatly improved. So in routine use, the vaccine should be given once about 4 weeks before breeding. The antibody response in these vaccines are relatively short-lived. They say about 3 months. So we vaccinating them at fall at PregCheck is not the best option. We want to do it pre-breeding, and in herds where we're having active infection, those cows should even be revaccinated halfway through the breeding season. Again, bulls are vaccinated for the same reason as cows, for treatment or for prevention, but they're typically given twice the doses for cows and vaccinated 3 weeks apart. Bulls can also be treated with an antibiotic, but this is probably not very common practice. It would kind of depend with your local vet what your plan is for that. So the third method that can be used for prevention is artificial insemination, as long as you're using semen that is not contaminated. So with Campylobacter, the bacteria has been isolated in cows for over 6 months after the end of pregnancy. So if you're going to use AI as a preventative measure, then you should do all cows for at least 2 pregnancies to limit that spread. Okay, so poll question. How many of you vaccinate your herd for Vibrio? 1 annually, 2 yes, but not every year, 3 no, 4 I'm not sure. And like I mentioned before, this vaccine is often combined with lepto, but the Vibrio is the V portion in the vaccine. Okay, so 15% of you said yes annually, 45% of you said no, and then 40% of you said I'm not sure. Okay, so case number 3. We have a 250 head commercial herd. The bulls are pulled after 60 days, and they normally have about a 6% open rate in their cows. This year, the producer noticed quite a few cows cycling in late summer after the bulls were pulled. And then at PregCheck, they had a 27% open rate and a few mummified fetuses. The majority of the cows were on a community pasture this summer, and this is the first year that they've ever done this. So another poll question right away. I'm just curious, how many of you send at least some of your cows to a community pasture? Okay, so 25% of you said every year, 69% of you said you never do, and then 6% of you don't have cows. So at least a quarter of you, are using those community pastures. So the next pathogen that we're going to talk about is trichomoniasis. So this is caused by a protozoa, Trichomonas fetus. It's very similar to Vibrio, in that bulls are the main carrier of the infection, and older bulls can remain infected indefinitely. Most cows are free from this infection within 3 months after breeding. So again, very similar to Vibrio. And then the most common sign is infertility caused by embryonic death. Important to note, although most cows will clear this after 3 months, just like Vibrio, the immunity is not long lasting and reinfection can occur. Transmission can also occur when semen from infected bulls is used for artificial insemination. So just like Vibrio, you're going to see lots of repeat rebreeding, If your breeding season is long, you're going to see that prolonged calving period. If the bulls are pulled after a short time, then you're going to see the higher open rates. And that's what happened in this case is they had the bulls in for 60 days. And then we had high open rates because those cows didn't have time to clear that infection and get rebred. Fetal death and abortions can also happen later in pregnancy with this disease, but again, not very common. And then with this parasite, you can also see pyometra infection in the uterus after an early embryonic death or breeding. So, like I already mentioned, the history and the clinical signs are useful, but essentially it can present exactly the same way as the genital campylobacteriosis. So very important that you need to, if you're dealing with one and you think you're dealing with one, you should be testing for both. For definitive diagnosis, T fetus is isolated from the preputial scraping sample, just like the Vibrio. So most of the time, this is going to be culture. Some labs are doing PCR. With this disease, 90 to 95% of the infected bulls will be positive on culture. But that being said, you can have positive bulls showing up negative on that test. If you're highly suspicious of Trich or Vibrio and get a negative culture on the first sample, we recommend doing 3 successive cultures at weekly intervals, and that's going to detect 99.5% of bulls. So control for Trich. There has been some treatment using antifungals in the past, but none of these have been proven safe or effective and are not approved in Canada, so that's not something that we do. Basically, control consists of culling infected bulls. So options are you're either eliminating the infection by culling all bulls and replacing them with virgin bulls, or you're testing and culling positive bulls. Like I already mentioned, repeated testing in older bulls may be unsatisfactory. Like you might have a positive bull, but you're getting a negative culture. So it might be prudent just to cull those older bulls if you are dealing with Trich. And then obviously reinfection is prevented by exposing only the uninfected bulls, the new virgin bulls, to uninfected cows, because the bulls can give it to the cows, but the cows can also give it to the bulls, and then those bulls can become carriers. Any cow that has a calf at foot is considered to be a clean cow. There is a small chance that an infected cow can produce a live calf, but it doesn't happen very often. And then virgin heifers are also considered clean. In situations where there's several herds that are commingled on the same pasture, like a community pasture, you need to be careful that your cows and heifers are not exposed to an infected bull at home before they go out to that pasture, because a lot of times the bulls are tested for those community pastures, but obviously the cows are not being tested. So the cows can still bring that disease into that community pasture. For this disease, vaccines have not been proven highly effective, and at this point, there's not really any good commercially available options. And then, like I talked about, keeping the clean breeding groups is really important in controlling that disease. So the last pathogen that I'm going to touch on tonight is leptospirosis. This bacteria typically most frequently presents as a chronic silent infection, so no clinical signs in the cows, but we're just having infertility due to embryo losses and repeat estrus. But it can also, different serovires of the bacteria can also present as more of an outbreak situation, which cause abortions at any time during pregnancy and weak calves. And this is more of like an outbreak situation, but it's less common. So diagnosing the bacteria in an outbreak situation is relatively straightforward because you can isolate it from, those animals that are having abortions or those calves, and the fetus and the placenta. In those herds that are having the chronic sort of infection with the early embryonic loss, that can be a little bit harder to diagnose because we can test for antibodies in these animals in chronically infected herds, but there is going to be cattle that are shedding the bacteria but don't have antibodies. So then it can be really difficult to find which animals are shedding that bacteria. So we either culture or use PCR to diagnose those animals. Typically urine is the primary sample that we've used in the past, but like a vaginal swab, cervical mucus can be used as well. So if you're dealing with this bacteria, the control can be really frustrating and often involves vaccine management practices and potentially antibiotics. Basically, the best thing to do is work with your local vet to come up with a plan that's going to work best for you and your herd. The serovir that causes the chronic infection, which is Harjo, a leptospirosis Harjo, is basically impossible to eradicate. So it requires constant management to minimize the effect on reproduction. So in summary, when dealing with infertility, whether infectious or not, what should we do? Step number one, call your local vet. We want to help. The most logical time to have us come out is to preg check your cows. We're going to show up in our colorful garbage bag suit with our white lightsaber and funny looking goggles, looking like a giant dork. But if there's any issues with infertility in your herd, this is likely where they're going to be caught first. So if there's a large number of open animals, or we're noticing things like mummies or a lot of late bred cows, then we should be taking a detailed herd history from you, discussing things like new additions to the herd, bulls used, current vaccine protocol, types of pastures you're using. If we are suspicious of an infectious disease causing the decreased fertility, then together we can decide where to start with testing. I will say that sometimes it can be difficult to determine, an infectious cause of fertility after the fact, especially if your cows have already cleared the infection, like with Trich or Vibrio, or if your cows were exposed to community pasture bulls, because obviously you can't test those bulls. But if you guys do end up finding an infectious cause to infertility, then you and your vet can work together to come up with a management plan. And often it involves vaccines. So on that note, I'm going to touch on vaccines a little bit. So when it comes to creating a vaccine protocol with your vet, there are going to be two big things that we're going to consider. The first one is going to be risk. What do your cows need protection against? Do you have an open herd and are constantly bringing in new animals? Or is your herd relatively closed? Have we already diagnosed an infectious cause of infertility in your herd? So do we need to protect against that? The second point that plays a big role in the type of vaccine protocol that your vet's going to recommend is when are your cows being handled? For some producers, their cows are only put through a chute once a year at preg check, and it's just not logistically possible or convenient to run the cows through again in the spring. For others, running the cows through again in the spring is like not too hard. So it really depends on that. There's no point in putting the herd on a spring protocol if you aren't going to be able to run your cows through. So the three main objectives that I usually have in creating a protocol for a breeding female are going to be to aid in the prevention of pregnancy and production losses, to protect from the development of BVD persistently infected calves, and to increase that colostral antibodies so that that calf has good protection when it's born. The three main vaccine components that I think are essential, one which we've talked about a lot already is BVD. Obviously, we know it causes infertility, abortions, birth defects, and that persistently infected animal is going to be harboring that virus in the population. So when we look at vaccines, we really need to pay attention and should be using a vaccine that has a FP or a fetal protection claim. So basically, what that fetal protection claim means is that if you're using that vaccine as per label directions, then it will protect that. If when that cow becomes pregnant, it's going to protect that fetus from getting that virus. It basically creates a shield around the uterus, in simple terms, and that calf cannot become infected with BVD, and it cannot become a persistently infected calf and shed that virus into the environment. So the FP claim is super important. The second component that I think is essential is bovine herpes virus 1, or IBR. It does cause abortions, but typically these abortions happen in the second half of pregnancy. So that's why I didn't really focus on this disease tonight. I wanted to focus more on pathogens that cause early infertility and that we're going to pick up at preg check time. So this is an important one to protect our herds against. There's two types of vaccines when it comes to the IBR component. There's either a killed component or a modified live IBR component. So basically, with the modified live vaccines, we're going to get quicker and longer lasting immunity. But if you use these modified live vaccines in a pregnant animal that has never had this vaccine before, it can cause abortions just like the actual virus would. So you really need to be careful of that. And I'm going to touch on that a little bit more on the next slide. The other thing that I want to mention about the modified live vaccines is that they do cause a transient inflammation in the ovaries of the breeding females. So these vaccines must be given at least a month prior to breeding if you're going to be on a spring protocol. Otherwise, it can cause subfertility, and then a lot of your animals are not going to catch on that first heat cycle if you're using it right as you're kicking those cows out for breeding. And then the third essential vaccine component is the clostridial diseases. And this is more, not so much that we see a lot of this disease in cows, it's more that it's the major pathogen encountered by calves. So we want the cows to be producing clostridial antibodies for this to protect those calves. So another poll question, which I kind of gave away my answer a little bit, but do you know the difference between a modified live vaccine and a killed vaccine? Okay, great. So 90% of you know the difference between a modified live and a killed vaccine. That's awesome. Perfect. So basically, when a cow vet talks about a modified live or killed vaccine, we're talking about that IBR component of that vaccine. So, sorry. So as I mentioned before, when we are using that modified live vaccine, we need to use caution in pregnant animals. So a naive animal would be considered any animal not vaccinated with the same brand and type of modified live vaccine during the last year. Any heifer not vaccinated at least once since weaning. So normally we say that any heifers that are going to be bred should have at least 2 vaccinations of that modified live vaccine before they get pregnant. So usually that's going to be at weaning and then pre-breeding. And then any animal that comes into your herd that you just don't know the history about. So like I said, if we are vaccinating naive animals with the modified live IBR, we can cause abortions just like the virus would. And then it can cause temporary oophorytis and subfertility, so inflammation in those ovaries. And then, yeah, like I've mentioned probably about 4 times now, use that modified live at least 30 days pre-breeding. And then once your cows are no longer naive, you can vaccinate them while they're pregnant. But this is kind of just getting them onto that program and making sure that you're not going to cause abortions with that vaccine. So other considerations when it comes to vaccines, there's scour vaccines. I just want to mention that they are a supplement to good management. Those scour vaccines are not going to solve all your problems. And then other vaccines, Vibrio, Lepto are at the top of those lists. And like I said, those are often going to be combined. Those are going to be the VL component of a lot of vaccines that we see. Just want to briefly touch on gram-negative overload. So basically this, all of these darker bacteria listed are gram-negative bacteria. And we just want to be careful not to overload our cow with too many of those vaccines at once. So kind of a rule at our clinic is we don't give more than 2 vaccines at the same time. So we don't really want to be doing our 5-way vaccine, our Clostridial vaccine, and our scour vaccine all at the same time, just because it can be a lot on that cow's immune system. So take-home point, proper timing and administration of vaccines are more important than type or brand. And this can be something that your local vet can help you figure out what's going to be the best for your herd. So this diagram is just kind of showing what a pre-breeding vaccination program would look like. So your calves get a modified live at branding, a modified live, and this is for replacement heifers, a modified live with the fetal protection at weaning, and then that modified live with fetal protection pre-breeding at least 30 days. And then annually, they're going to get that modified live pre-breeding with the FP claim, super important. They're going to get their Clostridial vaccine maybe at preg check in the fall. And then whether or not you use a scour vaccine, you're going to do that pre-calving. So the other way we can do it is the calves are going to get the same thing. Those replacement heifers should still be getting the modified live at branding, at weaning, and pre-breeding. And then at fall processing, we're going to do the modified live or the killed vaccine and our Clostridial vaccine, and then a scour vaccine if we're using it. So I'm just curious, what kind of vaccine program is your cow herd on? So we're in the modified live fall, modified live spring program, killed vaccine in the fall, or killed vaccine in the spring. Okay, awesome. So 12% of you have your herds on a modified live fall program. 76% of you are on a modified live spring program. And 12% of you are on a killed vaccine fall program. Nobody here tonight, I guess, has their cows on a killed vaccine spring program. So that's awesome. Basically, as far as protection and lasting immunity, the modified live spring program is going to protect your cows when they're most at risk for those pregnancy losses. So that's great. That majority of you are on a spring modified live program. One thing I just want to mention quickly is that a lot of people forget about vaccinating their bulls, but it's super important because really they're the only animal that comes in contact with the entire herd. And then our kind of what I would recommend is using a 5-way modified live, and that Clostridial vaccine 30 days pre-breeding would be ideal. Obviously, if you're dealing with, if you have Lepto or Vibrio in your herd, we're going to be using the 5-way modified live with that VL as well. So take-home messages for vaccines, complete a thorough risk assessment with your local vet, consider new additions to their herd. Are they naive? Do I need to be careful about causing abortions? Use a vaccine with an FP label claim in breeding females to prevent those PI animals. Vaccinate at least 30 days pre-breeding to prevent the subfertility due to the inflammation in the ovaries. And don't forget about your bulls and keep a written record. So just going to revisit this diagram one more time to wrap things up. Hopefully it makes a little more sense now. So in summary, under viruses, we have BVD that can have significant effects on fertility, not only during conception, but throughout the entire pregnancy, causing everything from early embryonic death to persistently infected calves, to calves with central nervous system defects, to late-term abortions. Then under bacteria, we have Campylobacter or Vibrio, which most often causes early embryonic death and can show up clinically in a herd with either high open rates or prolonged calving period, depending on how long your breeding season is. Under protozoa, we have Trichomonas, which can present exactly the same way as Vibrio. So if you're worried about one, you should be testing for both. And with both Vibrio and Trich, your older bulls are going to be your main carriers of this disease. And then finally, we have the bacteria Leptospirosis, which depending on the serovar, if it's Harjo, we can see more chronic infection with early embryonic loss and infertility. And if it's Pomona cryptotyphosa and ectohemorrhagic we're going to see more abortions throughout pregnancy and weak calves. So very important point is that 3 out of 4 of these pathogens have commercially available vaccines, and that's a large part of controlling the diseases and minimizing their effects. I really hope that you learned something about infectious causes of infertility, but I do just want to mention that, there's many other factors that can lead to infertility and high open rates in our cattle. So environmental factors such as drought and extreme heat, which we've unfortunately had for a few years now, overall nutrition, micronutrients and vitamins like Dr. Waldner spoke about last week, body condition and genetics can all play a role, and infection causes are only one piece of the infertility puzzle. So with that, thank you so much for listening to my presentation, and thanks again to the MBP and the MBFI for having me. I'm going to open it up to any questions now and try to answer them as best I can.
Thank you so much, Brittany. Yeah, so if anybody has any questions right off the hop, feel free to either raise your hand or pop it in the chat box. The first question we have is, will there be a window to positively diagnose a bull for Vibrio or Trich, in terms of like when's the best time to test our bulls?
So like I mentioned, with those older bulls, basically bulls that are like 4 years or older, those animals are going to chronically carry the infection. So really anytime testing those animals, we should find it. In those younger bulls, that infection can be transient, so, and it's really variable about for how long those bulls are infected. Might be a couple months. So I would say for the younger bulls, yes, there's a window, a couple months after infection, but with those older bulls, I think testing anytime is going to be successful.
You didn't mention it, Brittany, I'll give people a chance to maybe type or get their thoughts collected, but you didn't mention it in your presentation, but can you speak to maybe, maybe I'll like lead into it, but why farm dogs get very fat during calving season and why that's not a good idea to let them get fat, eating cleanings and whatnot. You did it.
Yeah, so basically they're getting fat because they're eating all these placentas. And not ideal because especially if you're having some abortions, those placentas can be covered in bacteria, right? That can, and things like Salmonella and E. coli can cause abortions, but those also can cause gastrointestinal disease in your dogs and in you. So you don't want your dogs bringing those into the house.
Certainly. And then I was also kind of leaning towards Neospora as well. There's
Yeah.
a lot of canines out here in
Oh,
Manitoba, and coyotes and foxes and
yes,
wolves. So
absolutely. Yeah. Like worms too. Yeah. We just don't want any of that in
for
our
sure.
houses.
Okay. Brittany, you mentioned quarantining. So when we're bringing new animals into the herd, how long should they be quarantined before they're introduced into the herd? And is there anything so that was the question I'm gonna add
Yep.
onto it.
Yep.
Is there anything we need to be looking for in quarantining? Or
Right.
is just
Okay.
having them segregated enough? Or is there a good way or bad ways to quarantine?
Um, really, if ideally, if you're quarantining, um, I would say at minimum 2 weeks for sure, because a lot of these diseases are going to have a bit of an incubation period before the animal starts to show clinical signs. So I would say at minimum 2 weeks, a month would be better. And then things, and when you're quarantined, important to think about too, having them in they're in a corral. Having fence access is not quarantining, right? If they can reach their head over the fence and get in with your main herd, they're not quarantined from your herd. So just keep that in mind. Um, things to watch for. I know I specifically mentioned it with the BVD. So in those cases, we're going to be watching for animals with diarrhea, animals that are just off. But I would just say any sort of illness, really should be watching for. But yeah, and in regards to the BVD, it's going to be the diarrhea and the yeah pneumonia as well. So
Thank you for that. There's a question here. If your herd is healthy and you are on new ground for beef production, I don't know if that's meant to say calving, but regardless, if your new herd is healthy and you're on new ground for beef production, do you need vaccinations? And yeah, I'm sure I know where you're going to go with this. But I mean, yeah.
I would say absolutely.
Clostridials anyway, for
Yes,
sure. Yeah.
I would say absolutely. Because you know, like you mentioned, Melissa, like clostridials, they're not going to be brought in by other cows. They're going to be in the environment. So whether your herd is closed, they're still going to be coming in contact with pathogens. And that being said, really no beef herd is 100% closed. You have to get your bulls from somewhere. Like there would be, yeah, you're still bringing animals in, even if it's a couple of bulls, so your herd is not closed. So, and those animals can, as we talked about, bring diseases in. So I would say absolutely, you might be lower risk and might not need to vaccinate for all of the reproductive diseases, but at minimum, the 5-way and the clostridials for sure.
Brittany, you mentioned how complicated it is to kind of troubleshoot your way through all the different things that can cause low conception rates or embryo death.
Yeah.
So we're doing this workshop series, and the first one was on minerals and trace mineral impacts. Next week, we'll be hearing from Dr. John Popp talking about broader nutrition and body condition and production. Do you have any thoughts in terms of where to start because testing is expensive, running our cows through the corral is expensive. So when do we start thinking about, okay, well, maybe I should be testing for disease like venereal diseases?
Right.
Where in the troubleshooting tree?
Yeah.
Can you walk
Yeah.
me through that a little bit?
Yeah, for sure. So, infectious causes are, I'll say they're important, but they're probably not the first place that I would go looking for problems. I'm going to start with the simpler stuff first. What is the body condition of my score, or body condition score of my cows? That's a huge, huge thing. Environment, like the drought, there's those things I think are going to contribute more than infectious causes. Like they would be a little bit lower on my list of when I start digging in. But it also is going to depend kind of on your herd's history and your risk for getting these diseases. You know, if you are a relatively closed herd, your cows don't go to community pasture, you know, you're using young bulls, that sort of thing, I would definitely not be looking at infectious causes first. If you are buying a bunch of old bulls and you don't know where they're from and you're on community pasture and you know that sort of stuff, a lot higher risk, maybe we bump that up a little bit of when we're gonna look. But basically that's a decision that your local vet can make based, you know, they have that relationship with you, they know your herd, they can help you make that decision on when you should be testing.
Could you maybe give like 2 biosecurity protocols that kind of usually give the biggest bang for your buck, right? We're talking about a lot of preventative, and biosecurity is a huge part of that. So I know it's really contextual based on the way you operate and whatnot, and calving season time and all that. But you know, your 2 highest recommended biosecurity protocols, or top 3, or whatever you think is the most important.
Okay. Yeah, this is going to vary a lot based on your production system. You know, I get one of the big things is like staying away from buying high risk animals. You know, those animals, they're going to bring disease into your herd, right? So that's going to be a huge management practice. You know, I beat the vaccine thing to, you know, I would consider that biosecurity, like prevention biosecurity. I've beat that point tonight, so I won't go on that anymore. But and then, you know, I would say a big thing too is, you know, I don't think we're very conscious about it. Producers and stuff, you know, we visit each other's farms all the time, and you know, are we washing our boots? Are we, you know, doing basic hygiene stuff? I don't think so, you know. So I guess considering that too. You know, your fences might be good, but your neighbors are crap. So you know,
that's always the case, isn't it?
Thing. Yeah, always.
So universal.
Yeah. So yeah, I guess just you know, trying to make decisions that are, you know, just it should be common sense stuff, but it, you know, often I think we forget about that basic hygiene stuff. Yeah.
Don't wear your farm boots to the auction mart.
Yeah.
Yeah.
Probably shouldn't do that. No.
Yeah, absolutely.
When we have infected animals in like a corral, so we quarantine them, they have no nose to nose contact, but maybe we get a sick cow in the group. How long would that corral, quote unquote, kind of be hot with that infection? So is there, how do we, it would be the environmental control of shedding, maybe be the better way to frame that. Is there
honestly
recommendations or thoughts on that?
This is going to be so variable based on what disease you see, right? And yeah, like what disease you see these quarantine cows have, and you know, are you testing to figure it out, right? So really hard for me to say, you know, how long that could be persisting. You know, a lot of things like pneumonia, those bacteria are going to already live in the cow normally. So your herd already has those bacteria, but you know, it's just whether that animal becomes immunosuppressed and then those bacteria take advantage of that and cause an infection, right? So a lot of the pathogens that we see are actually already there, but they're just, you know, taking advantage of a situation to cause disease. So I'm going to put this one again back on your local vet. You know, if you're having situations like this, you need to talk to them to come up with a plan, because every herd's going to be a little bit unique, you know, in what's going to work best for your herd. And yeah, they can help you decide that.
We have no more questions coming up in the chat. I see no hands raised. I'm just going to double check for raised hands, but I don't think I see any. No. If anybody has a question, they are free to unmute to ask it. But in the meantime, feel free to interrupt me. But thank you, Dr. Brittany Sigvason, for the informative presentation. We're really grateful to have you on this webinar series tonight to share your knowledge. So thank you so much for that.
You're very welcome. It was my pleasure.
As Mary Jane said, this is the second in a series of 3. So we're pleased to bring you next week Dr. John Popp, kind of tying it all together. So management decisions that can have an impact on cow fertility. So he's going to bring it on home for us. So that's great. He's very knowledgeable. I've known him a long time and very relatable in terms of chatting with producers. So please join us for that. Same bat time, same bat channel. You can use the same link. Again, I'm dating myself, Romper Room and Batman. Oh my God. And so, yeah, thank you on behalf of Manitoba Beef Producers and Manitoba Beef and Forage Initiatives for joining us tonight. And no one has interrupted me. So I am assuming we're all done for the evening. So thank you, everybody, for joining. And thank you again, Dr. Brittany Sigvason.
Yeah, thanks for having me.